Gritty Urban Saga. So the FDA, the Food and Drug Administration, has called for a safety review of all antibacterial soaps. Now, you probably have one of these in your home. I have one of these in my home. Most people do. And the reason that they've called for a safety review, actually there's three reasons that they've called for this review. Reason number one is that these soaps have never been proven to kill bacteria better than standard soap and water. So that's reason number one. Reason number two is unanticipated hormonal effects. I quote, unanticipated hormonal effects. And I'll come back to that as well. And then reason number three is they're boosting drug-proof bacteria, basically the superbug. And so, okay, so to rewind and go back to this. Now, there's a chemical in most antibacterial soaps called triclosan, triclosan. I'm probably mispronouncing it either way. But this chemical has been on the market since 1972. 1972. It's 2013. It's almost 2014, and this product is just now getting reviewed. That's a little outrageous to me. Okay, we trust these administrations to keep us safe from things like this, to where we can go to the store and buy a product, and what it says on the label is what it will actually do when it gets in the house, and it's safe. These things that we trust these administrations to test. That way we don't have to have a lab in our house and have lab rats that we test these things on and have conclusive studies before we wash our hands. We trust these administrations, and it's been since 1972, and now we're getting a review on it. That's outrageous. It's ridiculous. And another thing that makes this ridiculous is that these companies that have these chemicals on the shelves in stores, they're not pulling them off the shelves. They're not doing anything of that sort. They're giving them till the end of 2014. They're giving them more than a year to provide proof of tests that show that their antibacterial soaps are better than just soap and water, standard soap and water. I'm sure that an average person would be outraged to know that something is going to be on the shelves. How long does it take? Something's going to be on the shelf for a full year while they review and see if it's actually what it says it is. You're a multi-million-dollar company. You're probably, some of these are probably billion-dollar companies, and it takes you a full year to run some tests on some soap. It's crazy to me. It's actually crazy to me. The second reason, these unanticipated hormonal effects, they've actually run tests on this already. They've actually tested this on animals, the antibacterial soaps and the triclosan, and they've found that yes, there are differences in the hormone levels in these animals. And this is another thing that outrages me, is because since 1972 this has been on the shelves. So there are whole generations of people who have been using this their entire life. Using these soaps, and who knows what type of hormonal effects it's caused. Who knows what issues with coping or just mental issues, things like that. Who knows how far it goes? There haven't been tests, so we could potentially, in our want to keep things clean, we could possibly have damaged ourselves and everyone else around us because these companies haven't been held accountable. It's just outstanding. It really is. And then the third reason that they're reviewing this is that it's shown to boost drug-proof bacteria. So it's creating the superbug that we keep hearing about. It's creating bacteria that are resistant to treatment. Now, if standard soap and water hasn't been proven wrong, if standard soap and water has been tried and true for years and years, what is the point of using these antibacterial soaps while they're under review? This is basically my call to action for most of the people who are going to be watching this video. I'm not talking about people who have issues with their immune system, hormonal issues with being resistant to bacteria and things. So if you're one of those people, I understand you need to keep things clean. And you can't risk it and that's fine. I understand that, and there's no reason why you shouldn't be using these things. But people who have no sort of immune system disorders or things like that, I'm calling for you to just put down the antibacterial soap and just use regular soap and water. And wash your hands, sing the happy birthday song twice while you're washing your hands, like nurses and doctors do, and just put it down. Put down the antibacterial soap, because it's not proven to do anything for your family besides help create the superbug. And it has a lot to do with this separate mentality that a lot of people have. I'm sure it's been over history, but it seems more prevalent recently, that people feel that, why do I care? You know, if you're not in my family, if you're not in my circle, in my clique, in my gang, then I don't care about you. You can go do what you're going to do, because I'm going to keep my people safe over here, and I'm going to keep my family clean with these antibacterial soaps. But you don't understand that if everyone has that mentality, and we keep leaving, because on these labels it says it kills 99.99% of standard household bacteria. It says something like that. So there's still that 0.01 that's getting stronger, that's not getting killed. That 0.01 times 2 billion households, that equals we're making the superbug. That equals that if you keep having this mentality of we're separate and it doesn't matter, that there's a fine line between I just thought of this, but it's funny. There's a fine line between keeping your hands clean and creating World War Z. And who knows where this is going to go, because these studies, they're giving these companies till the end of 2014 to prove it. And even if they are proven wrong, it's going to be until 2016 before these things actually go into effect, before these reviews and sanctions and rules get changed. So we basically have 3 years of possibly creating what's going to be the superbug here. So I just, like I said, I'm calling to action. Everyone who has the ability to put down the antibacterial soaps and just get regular soap and water, just do it. I mean, you're helping yourself, you're helping mankind basically at that point, because the superbug is probably not going to know any sort of borders between your house and somebody else's. So that's my thoughts on the subject. Gritty Urban Saga.